Minister of Health Honorable Kwabena Mintah Kando has disclosed that the new conditions of service proposed by the Ghana Registered Nurses and Midwives Association are not factored into the 2025 national budget and could significantly strain the economy if implemented immediately. Speaking at the presidency, he emphasized government's commitment to avoiding economic hardships while seeking a mutually acceptable resolution. To mitigate the impact of ongoing strike on healthcare delivery, the ministry has published a list of functional health facilities and is calling on retired nurses and midwives to temporarily support the system. The minister expressed gratitude to those still at post and reaffirmed the government's commitment to dialogue.
Yesterday, Monday, 9th June 2025, we invited the Fair Wages and Salary Commission to engage the GRMA, the Ministry of Finance, and the Ministry of Health to deliberate on roadmap for the successful implementation of the new conditions of service. At the meeting, the Fair Wages and Salary Commission once again, in accordance with law, directed the GRNMA to call off the strike to allow negotiations to continue. Government wishes to stress its readiness to further engage with a view to implementing the conditions of service in a manner that does not dislocate the national budget. We wish to draw attention to the fact that the conditions of service under reference are not captured in the 2025 budget and will completely throw the economy off gear if implemented immediately in the manner it currently exists. We are mindful of the serious economic consequences of unbudgeted expenditure and want to avoid the economic slippages that led to the hardship in the recent past. Government commits to continue to engage with the nurses in order to achieve a mutually acceptable outcome in the interest of the public. While working around the clock to resolve the impasse, the Ministry of Health has taken the following steps to mitigate the suffering of Ghanaian patients unduly affected by the strike. The ministry will, in the next few minutes, publish a comprehensive list of facilities to complement facilities where nursing services are lacking and where patients can seek health care. Given the urgency of the situation and suffering of the patients, government appeals to public-spirited retired nurses and midwives to volunteer their services for a brief period pending the resolution of the impasse.
The Deputy Finance Minister Thomas Nyarko Ampem revealed that the proposed conditions could increase the compensation budget by over 2 billion cedis. He appealed for continued negotiations between the Ministry of Health and the Ghana Registered Nurses and Midwives Association to develop a realistic roadmap that reflects current budget constraints.
From the Ministry of Finance, we want to show our commitment to help in resolving this important issue because our nurses are very, very critical to healthcare delivery, and we appreciate what they do. But the reality is that we have over 120,000 nurses, and the implementation of the current condition of service that they are demanding will have serious consequences for the budget. In fact, if we fully implement it, we are going to add in excess of 2 billion cedis to the compensation budget. We have all committed that in our resolve to reset the economy of this country, we must maintain a 1.5% primary balance surplus every year in order to bring our debt levels to sustainable levels. And so it is important for us to manage expenditure. And so we want to appeal to our revered nurses that we are willing to negotiate, to sit with them and the Ministry of Health to agree on a roadmap that will help us incorporate what can be accommodated in the budget for next year. And we believe that they have all seen the hard work we are all doing to manage the economy better. We want to appeal to them that they should let us sit down and discuss what can be accommodated so that we can all have a win-win situation for all of us.